Great, thank you. Hi, everyone. I'm Dr. Roshni Ghosh, and I'm the Executive Director for the Center for Care and Payment Innovation. I want to extend a warm thank you to Zufall for inviting me to speak today about our new pilot program called VETSmile. But first, if we go to the next slide, let me frame the problem for you that we're trying to address through VETSmile's program. Currently, there are 9.2 million veterans enrolled in VA healthcare, and about 85% of those veterans do not have dental benefits. And of those, there are about 1.3 million veterans who have the most limited access to dental care based on income. You go to the next slide, please. So reaching rural veterans is a priority for our program. Of the nation's 62 million rural residents, 43% lack access to dental care. Untreated tooth decay is more frequently observed in rural areas, and rural adults are more likely to have all of their teeth missing, which in general is just a very hard quality of life, and it just has a lot of impacts in terms of their social interactions and just general self-esteem, as well as their overall health. Next slide, please. One of the things that we're focused on in this program is to really connect oral health to whole health. My center is focused on driving the VA towards high value care and value-based care. And if we aren't addressing the need for oral health and the disparities in oral health, we really cannot have a very effective program. Some of the impacts of oral health on whole health, there's heart disease, increasing chance of stroke, cognitive decline, as well as diabetes. Actually, if we could get 70% of diabetics dental care, the rate of uncontrolled or poorly controlled diabetes would drop drastically from 34 to 24%. And there's obviously more impacts, as you can see on this side, and they all just start to compound. Next slide, please. So what is VETSmile? Well, we're a program it's a pilot program that was started on July 1st, 2021 of this year. The Center for Care and Payment Innovation is a relatively new center. Where, as I mentioned before, we're focused on driving the VA towards high value care. We also have a unique authority where we're able to change law with congressional approval, and we run pilots to support those waivers. And the first waiver that we requested from Congress was to allow the VA to refer veterans to dental care in the community and not be responsible for the services. Prior to this, they couldn't even refer them or at least connect them to the dental care partners. And so that just continued to increase the gap. So right now, we are building a community of dental care partners. Zufall is one of those amazing partners that we have. And all of our dental care partners are offering comprehensive dental care. They're spanning from preventive oral care to dental restoration. And one of our asks is, as the veteran gets connected to these dental care providers, that they are basically put into a dental home and are able to receive care for as long as they would like. Next slide, please. So we have two models. We work with large dental universities because they have the capacity, and we align those to VA medical centers where there's a referral model, which is very unique because the primary care physicians are the ones that are identifying the veterans that are in need of dental care. And then those names are sent over to the dental university, and then the dental university will then reach out to the veterans and bring them in and see what needs they have and take care of them, and then they become their patient. The other model that we have is a cohort model because we understand that capacity can be an issue. So we identify the number of veterans that are in need of dental care, and then slowly connect them to dental care providers based on the ability for the dental care providers to see the patients. Next slide, please. So currently we're operating in 2 states, New York and New Jersey. And as of early November, we've been able to see 400 unique veterans that have received care through this program. And we already have the capacity to see thousands more. So it's very exciting. And one of the things about this program too, is that we ask for the dental record or the dental encounter to come back to the medical record so that we're able to track the fact that the veteran has been seen for their oral health needs. Next slide, please. Where we're going next, we are going to be expanding rapidly nationwide. Our pilot is for 5 years, and our goal is to be nationwide by the end of those 5 years. But as we continue to expand across the country, we're really starting to delve into more of the challenges around serving rural communities. Next slide, please. We partner with federally qualified health centers, and 39% of those are in rural areas, and many of them are offering dental services, which is very exciting for us in terms of being able to expand the program. But as everyone knows, it brings a lot of different challenges too for the veteran to be able to access these services. So if we go to the next slide, some of those are transportation, internet access. We're also having challenges around having up-to-date contact information for the veteran. A lot of times there are no existing relationships with the VA, and there's a low density of dental schools. So the capacity for us to be able to bring in as many veterans as we can, we have to start looking at different types of relationships. And as we start expanding into other states, we're learning that funding is very different. Like state Medicaid status for the adult population differs. Insurance providers are different. And a lot of times there's lack of funding in general for these kinds of services. Next slide, please. So there's a couple of different areas that we've been tackling. So there's quote unquote the disengaged veteran. They're in a rural area. They are not as close to services. So we're focusing on connecting them with the VA and other health facilities. There's the infrastructure and accessibility barriers to dental care. So we have been very focused on linking to veteran service organizations and nonprofits and others that are very focused on helping not just the veterans, but those that are really trying to access care and are not able to. There's definitely a lack of veteran awareness of implications of oral health. I think that's a general population thing. And part of this program is to educate veterans on the benefits of making sure that your oral health is taken care of, that you're focusing on preventative dental care, and how that would impact your whole health. There's also a component where we're able to train and educate dental providers too about the needs of veterans who may have service disabled issues or just other disabilities that we need to be mindful of. And then the fact that there's a low density of dental care providers in as you start moving away from urban areas. We have been very lucky to have partnerships with ADA and NAC to be able to enhance our partnerships with federally qualified health centers, and working with groups like Zufall, who have been incredible partners and been able to kind of help us work through the kinks, has also been really instrumental in getting our message out. And the final slide is that I really understand the need for dental care. Rural health the rural areas are going to be very challenging for us in terms of being able to deliver this program. And I almost have a little bit of a call to help or action. If anyone's interested in participating or helping out, please feel free to reach out. And I'm really interested in learning more about how people are addressing some of these challenges that we have been identifying. Thank you.